This February will be the 5th year for the National Wear Red campaign. It's a reminder that more women die from heart disease than any other disease. One reason is women's symptoms are usually different from the typical sharp pain men feel.
Women more often have shortness of breath. They may have pain that's not in the typical location, maybe not right in their chest. And of course the typical symptoms, either in men or women, but more commonly in men, are substernal chest pain that feels more like a pressure sensation. Patients feel like they're going to die. Then the pain may radiate down the left arm or up in the jaw.
Dr. Austin says it is always better to be safe rather than sorry and get checked out if you suspect something is wrong.
I heard a professor once say that anytime you have pain between your chin and your belly button, you ought to consider it heart disease and go from there.
A regular checkup is not a bad idea if you have any of the risk factors, which include high cholesterol or high blood pressure. If you are overweight or smoke, your chances are better for developing heart disease. But playing the waiting game will only hurt you in the long run.
When you start losing heart muscle, that's when this time becomes critical. And up to 6 hours from the onset of pain is really the time that you have to save that heart muscle.
Insurance companies measure the time it takes to get treatment in the emergency rooms, so things happen quickly once you arrive. If surgery is needed, then there is another issue that women face.
Women have a smaller body size and the arteries in the heart are smaller, so it just becomes a mechanical problem where the arteries are so when we do coronary bypass surgery, we actually sew a graft onto an artery, so it's a lot easier to sew a graft onto a bigger artery than it is a very small artery.
Some diabetics may have issues with infections setting in, but otherwise the next step is recovery, which begins with a heart hugger.
After surgery, we rewire the sternum, and so if patients have a lot of coughing after surgery, then they can cough their wires loose, and then that's a real problem to have the bone separate after surgery, as you can imagine. So some kind of compression device I think is helpful.
At this point, at least 1 month of downtime is critical.
It's just like the oxygen mask on the airplane. You know, they say put the oxygen mask on yourself first, and then you'll be able to take care of everybody else. So same parallel applies here. The women have to take care of themselves first, and then they can go back to their regular duties.
Most women will also want to wear a higher neckline after surgery.
I'll tell you one thing that I was concerned about when I went into practice 18 years ago is I thought that women would be terrified of the cosmetic result from surgery because it does involve an incision that goes almost up to the neck. But I must say, I was thinking about this last night, but I don't think I've ever heard a woman express concern about her cosmesis over her concern for her safety.
Dr. Austin does believe in the future we will see more robotic heart surgeries and smaller incisions.